The largest nursing strike in New York City's history is now underway, with 15,000 nurses walking out early this morning. Newly elected Mayor Zohran Mamdani joining that picket line. Among their demands, the nurses are asking for higher staffing levels, and they say they're stretched too thin and that patient care is suffering. Mamdani today urging them to keep negotiating.
All parties must return immediately to the negotiating table and not leave. They must bargain in good faith.
That's right.
And they must arrive at a deal that is satisfactory to all, that allows the nurses who work in this city to live in this city.
The work stoppage comes amid a severe flu season, raising concerns about patient transfers, canceled procedures, ambulance diversions, and added strain on hospitals not involved in the dispute. Joining me now for more is Aretha Morgan. She's a pediatric emergency room nurse at York-Presbyterian Hospital. She's also a director at large with the New York State Nurses Association, and she's also on strike. Aretha, thank you so much for joining me. So you heard there from Mayor Mamdani. He's standing on the picket line this morning with the city's nurses and calling their fight a battle for dignity, fairness, and the future of the city's healthcare system. Do you think that support from the mayor will help make a difference in negotiations?
Thank you, Stephanie, for having me on. I could tell you right now, having Mayor Mamdani come to our picket line in full support of nurses, I mean, we're over the moon. We feel so supported, not only by him, but the rest of the city. There was 4,000 plus people out there, and we are over the moon. Thank you all for the support.
Yes, so many nurses out there. The mayor was out there. I'm curious to know, how is this affecting patients right now at hospitals?
So, it's breaking our hearts. We would have to leave the bedside. All our patients love us, know us, ask us by name. But we know that all we wanted to do was get a fair contract. The hospital's executive would not even come to the table long enough to actually have a good conversation to get to that decision. They forced us to come out. We could have had this done even up to last night. They told us, see you in the future. We had no other choice.
And we've got some of the sticking points there on the screen. Can you walk us through some of the key sticking points that nurses are asking for with this strike?
Definitely. Better staffing ratios. To have one nurse with 20 patients in an emergency department where people are bleeding, having heart attacks, strokes, it's just not safe for patients. And we've been saying this over and over and over. We've met with hospital executive after hospital executive promising better, nothing coming, and it's just getting worse. Patients are upset, and this is not good.
And
Workplace
Yeah, and I think you were just about to touch on that. I think something people may not know is that there is some workplace violence taking place at some New York City hospitals. And you say some of the management refuses to put protections in place. So talk about the safety issues and increased violence against nurses at New York City hospitals.
Sure, I'm on the security committee, and they showed us the thousands of weapons that come in, from guns, knives, razor blades, shillelaghs, shards, and they get through the metal detectors. So how are we to take care of patients if we are not safe? It just keeps coming in.
Certainly. Well, we hope there is a resolution very, very soon. Aretha, thank you so much for joining us on ABC News Live.
Thank you very much for having me, Stephanie. Thank you.